Mumps is a single-stranded RNA virus that belongs to the paramyxovirus family. And first, I would like to provide a quick explanation to this family. Paramyxoviruses include the parainfluenza, RSV, and mumps. And all of these viruses are capable of infecting the respiratory epithelial cells, and then from there on, via the F protein, which stands for fusion protein, they will make respiratory epithelial cells to fuse together and form multinucleated cells. And in fact, one of the treatments directed against RSV is to use polyvizumab, which is an antibody that is directed against the F protein. In any case, mumps belongs to the paramyxoviruses family, and its classic presentation is parotitis, which means there is an inflammation of the parotid gland. And these patients usually present with elevated amylase. And then about 48 hours later, they present with other symptoms such as fever and anorexia. In addition, there are other complications such as parotitis, which means inflammation of the testes, as well as meningitis. There is a vaccine against mumps virus, and it's called MMR vaccine, which stands for mumps, measles, and rubella. And this is a live attenuated vaccine. And you know how HIV patients are usually only treated with dead viruses. MMR is one exception that is used in HIV patients that are not immunocompromised. And the reason for that is that if they get infected with any of these viruses, the complications are much more severe. And thus it's recommended to vaccinate HIV patients that are not immunocompromised with the MMR vaccine. And that concludes our discussion.